we are coming now to our final presentation, our final speaker of the day, who's going to talk about the role of mobile technology in health financing and delivery. He is the director for the West Africa area at Farm Access, and joining us now is Dr. Kwasi Boahene. Good afternoon, and let's hear from Dr. Kwasi now.
Thanks a lot. Thanks for the organizers for having me here. I'm going to share with you how mobile technology is transforming the financing and delivery of healthcare in Africa. But before we do that, set the discussion in a bit of context. So, you know, as you all know, or most of you will know, about 30% of the people in Africa has some sort of basic healthcare. So the struggle to provide healthcare to Africa has been going on since 1978, you know, when the World Health Organization brought the world together to look at how health can be financed and delivered. So, you know, they made some progress, but not much. And somewhere in the year 2000, we had the Millennium Development Goals, you know, which also set some ambitious targets for healthcare. And certainly with the Global Fund and the like coming in, considerable progress was made in the area of financing and delivering, you know, HIV/AIDS care, malaria, TB. You know, we brought mother-child care. We brought the mortality of women dying during pregnancy, and also children dying at the age of 5 down. But we still face with huge challenges. So 2012, around that time, there was also the need to have another global effort, and which is called universal health coverage. So universal health coverage is where the whole world comes together, you know, to also revive the effort to provide healthcare. So, you know, the world is not short of ambitions. The challenge, of course, has been how to finance the care and deliver it on a continuous basis. So just to give you a bit of context still, Africa consists of or account for 14% of the world population, but it has 21% of the disease burden. And this has got to do with the fact that all the efforts until now have not made much progress. You know, I'm not proud of reciting these statistics, but you know, they will help us to put our discussions into perspective and also see the progress that is being made. The challenge is that although it has 21% of the disease burden and 48% of communicable diseases, only 2% of the global health expenditure is made in Africa. And that obviously presents a major problem. What we see is that because not much money is spent on health, and you know, whether at the individual level or at the government level, the challenge is that only few people on the continent have access to health insurance. You know, we all know that if any country wants to address the financing of care, it's important to have an inclusive financing mechanism, you know, where you bring poor and rich people together, you bring rich and young people, you know, you bring sick and wealthy people. The whole idea of bringing people together so that at the end of the day, you'll be able to mobilize resources and spread it across the various risks. We see that in Africa, that mechanism is lacking. So what this graph shows is that Rwanda leads when it comes to health insurance. Ghana has also done very well since 2003. Providing insurance to its citizens, and of course, the other countries follow. The irony is that the rich countries, relatively richer countries in Africa, they are not spending much on care, and you can certainly see that in this graphs. And of course, if this is the situation, then there will be some consequences. The most obvious consequence is that because people have limited access to care and they have limited means to pay for it, when they get ill, they have to pay this out of pocket. They have to use their limited resources that they have. And then you get into a situation where most people become poorer when they become ill. So what we have here are some, not fascinating statistics talking about the fact that when people get ill, they become poor. And globally, every year, about 100 million people become poorer when they have no access to care. And I think this is something that we all, rich, poor countries, governments, companies, organizations, we all have to work to address. But there is some hope. So unlike 1978, early 2000, when the world had the ambition to address healthcare, the world faced at that time some major challenges. If you're dealing with financing of care among poor people because they cannot pay for care and because they don't earn enough, you really need a mechanism where you can, if it's insurance, you can administer the insurance at a lower cost. And that means that you need technology. 2000 and somewhere in 1978, we didn't have that technology. Fortunately, from 2000 onwards, what we see is that technology, and particularly mobile technology, is booming in Africa. I don't think it will surprise you to hear that in Africa, 10% of the GDP transactions is through mobile payments, compared to 2% in Europe and the US, meaning that Africa actually is leapfrogging the world when it comes to mobile technology. Then obviously the question is, how can we use this mobile technology to transform the delivery of healthcare? What you see is that most organizations, countries, companies who are using technology are looking more at how you can use technology to deliver care, to deliver a service. Most of them are not looking at it in terms of how you can use technology to mobilize financing. If we don't have financing, if money is not there, there's no way that we can actually, implement all the brilliant ideas that we have. So, my organization, Farm Access, where we work we have offices in 4 countries, but we work across Africa. We are leveraging technology to, first of all, show how it can help mobilizing financing for health. So we the head office is in Amsterdam, We have country offices in Ghana, Nigeria, Kenya, and Tanzania. And from these offices, we work with both the public and the private sector to in our words, to transform the financing and delivery of care. So what this slide shows is that in Africa, on the left side, people are using mobile technology and mobile phones to exchange messages, whether it's WhatsApp or SMS. They go to Facebook. They do all kind of stuff with mobile technology. Particularly when it comes to SMS, and that kind of thing, we are not really talking about the fancy smartphones. We're just talking about the future phones, like Nokia and etc. And people are using it a lot. What the amazing thing that has happened in Africa, and I think most of the listeners know about, is that in Kenya, Safaricom started M-Pesa. So they saw the potential of mobile technology, and they used the mobile technology to support people to send monies to each other. So you can see money as a form of entitlement, where A send monies to B, B send it to C, and by getting access to money, people then get access to services. And we're talking about a situation where most people don't have access to bank accounts. As we speak now in Nigeria, more than 40 million people don't have access to bank accounts. So if there is a technology that helps people to exchange money and entitlements, that will go a long way in improving their livelihoods. So Safaricom has used that in Kenya and for commerce. What my organization, Farm Access, is doing is, can we also use the same formula for health? Where you have a platform that allows people to get access to entitlement and to money, and that enables them to have access to care or be able to pay for care. So we have collaborated, like I said in the beginning, we collaborate whether it's government or it's private, and because when it comes to healthcare, there's no need to discriminate. What is important is who can deliver the care. So on the technology side, we have partnered with a company, a social enterprise called CarePay. So CarePay is based in Amsterdam, it's based in Kenya and Nigeria. And together with them, develop a digital platform, mobile platform that allows people to do three things. And for this presentation, I'm going to share with you the work that we're doing with CarePay and our partners in using technology to finance and deliver care. So what a platform, it does, or it has three most important components. The first is that there is a mobile health wallet. So the platform connects the individual, it connects the provider of care, and it connects the payer of care. So for the individual who needs care, there's a mobile health wallet that the individual can use. And that mobile health wallet is on the phone of the individual. And like I said earlier, it can just be a feature phone like Nokia. You don't need expensive smartphone to be able to access your mobile health wallet. So look at the mobile health wallet as the wallet that you have, your physical wallet, where you have all your credit cards, and you put it in your pocket and you go to the shop, and then you can draw your bank pass or credit card to pay for services. The mobile health wallet has that potential where you can actually use, people can deposit entitlements in your mobile health wallet. If you can receive insurance entitlements on your mobile health wallet. If a funder is financing a particular program, let's say mother-child care program for pregnant women or for babies, the entitlements can be stored on the phone of the pregnant woman. What it means is that if the pregnant woman goes to a clinic, the clinic, by accessing the portal, which is for the provider, the clinic will be able to see the entitlements that that individual has. The provider portal allows the clinic also to administer and manage care for this individual. Then, of course, what's important, if you talk about the individual and the provider, is how can the person managing the scheme, in this case, insurance scheme, how can that entity be able to have insight into the transactions? So in the case of an insurer, the insurer also has an insurer portal, and it allows the insurer to be able to manage the transactions. If it's also a funder that is providing the funding, the funder will also get that insight through the same portal. So, and we call it MTIBA in Kenya, and in other, like Nigeria, it's called CarePay platform, named after the social enterprise implementing this platform. So the beauty of the platform is that on the left side, you have a situation where, you have so many entities, they want care, and everybody is doing their own thing, for the benefit of one individual. So, not to mention names of organizations, you can have, 5 organizations contributing to pay for care of an individual, and they are all relating to the clinic. So you have sort of a messy situation, which is quite inefficient. On the right side, you have a situation where every funder or payer paying for the care of an individual, they can all put that entitlement or funding into the mobile health wallet of this individual. So you have sort of synergy, and that's what you see on the right side. So bringing efficiency into the system, but at the same time the transparency that is needed. So for a clinic providing care for an individual, the clinic doesn't care so much about who is paying for the care. So what the clinic cares about is that the individual who is in front of me, in this case a patient who needs care, that patient is getting the care and the money is being paid for. In the old system where everybody is making the transaction, this clinic has to do transactions maybe for 5 funders, because every funder wants a report, they want an update, they want a review and all those things. But if they can all participate in the technology on the right side, where what is needed is that you have a wallet. The wallet is based on the telephone number of the individual, so it's the most important identifier. Then, they can all pay. They get the payer get the services, and the clinic gets paid. This is still to illustrate the point that with mobile technology, you will be able to mobilize financing, channel them efficiently, and deliver the care that the individual needs. So just to illustrate here, for example, you have the Global Fund, you have USID, you have organizations focusing on specific care. If they can all agree, to focus their resources or channel their resources through the mobile health wallet, this individual will be able to get access to financing and ultimately access to care. So that's what we say, the combining financing flows. It also empowers the individual because, this individual at any point in time can check the resources that it has, and it's the individual that authorizes the clinic, to deduct payments or make payments out of the individual wallet because that individual has access the care. This is still to illustrate the point, and the beauty of mobile technology is that you'll be able to ensure adherence to care. So what it means is that if an individual with a mobile phone, a mobile wallet is linked to a facility, and that facility, in this case a clinic, can send a message to the individual if the individual doesn't show up for care. They can also send information to guide this individual on treatment protocols, which we know for some diseases, if you don't follow the protocol, you can develop resistance, and that can be as fatal as the disease itself. Because of the platform, the provider, the clinic, can also certainly induce health-seeking behavior, by sending messages to people linked, to the platform. And of course, as I said earlier, you can the provider can certainly monitor the health outcomes. You get so much data. The beauty of mobile technology is that you get data. In most cases, real life data, which actually helps in improving the delivery of care. So so this is the approach. Let me briefly take you through how we have applied this approach in specific situations. So we are implementing the digital platform in Kenya and in Nigeria, where we are supporting health insurance initiatives and agencies to manage or administer their health insurance to the platform. By using technology, you'll be able to increase coverage much better than if you were doing it manually. So we've done it in all these countries where we work in. We're also supporting them to make maximum use of the data that they get. Analyze the data, in that case, get some lessons out of it, and use the lessons either to improve their financing of the scheme or to improve the delivery of care itself. So Tanzania, we're working there. We're also working in Ghana. In addition to the two countries that I mentioned, and we are also we've also started working in Zanzibar. And we believe that the lessons and the models that we have developed and implementing in these countries can also be applied to other countries. Yeah, so what we've seen is that certainly financing is important, and we've worked a lot in ensuring that, the countries, the initiatives, they'll be able to mobilize financing. But at the same time, you've also seen that the improving the delivery systems is equally important. Because, if the quality of care is not optimal, people will not go to clinic, even if the care is free. Nobody wants to go to clinic and come back home with a disease. So we've developed an approach which we call safe care. So that approach builds on the World Health Organization standards, but they make the implementation of those standards applicable in local context by, in the sense that we provide technical assistance, capacity building training, we do assessment of the facilities, and the outcome of the assessment, help healthcare facilities or providers to develop their plans and then support them to implement their plans. So, I have some statistics for you here, which says that, we have about 4,000 clinics, participating in the safe care approach. And every month, these facilities receive like 4.2 million patient visits. It's quite substantial. So, and so we started. Now we are using technology to improve this approach. So an important component of this is what we call Safe Care Quality Platform, which provides data to the healthcare facilities. Because, at the end of the day, if you have data, then you can make informed decisions about the quality improvement approaches that are required for your facility. There are also, what we also done, and I think that's the next slide, is that also using technology to do the mapping of facilities, so that you can see, where the facilities are distributed, and you can also see the level of standard or improvement that they have made. And all this data is available to the facilities, because at the end of the day, that's the most important thing. How can they use these approaches and the data to improve upon the services? Yeah. So that's been done. What we've also seen, and I emphasized that when I was talking about the insurance, is that financing is critical. So the financing consists of two parts. You have the financing for the service itself, which, in most cases can be insurance. It can be a funder having specific paid for performance financing mechanisms that goes into financing the care itself. But other part of the financing, which is important, is the investments that healthcare facility needs. If you are asking facilities to improve upon their delivery systems, they need money to do that. So within our organization, since 2009, we have initiated, we've started an initiative, which is called Medical Credit Fund. And the Medical Credit Fund is the first impact fund in Africa, focusing on the small and medium-sized facilities. So the Medical Credit Fund does two main things. One is that it provides training and helps healthcare providers to manage their operations as business, and also helping them to develop business plans. Doctors think that because they are clever, they can do everything. But you've seen in the healthcare space that managing the business, managing care system, hospital is a profession on its own. So with the Medical Credit Fund, we're providing the training and the business development expertise to make them do that. In addition to that, the Medical Credit Fund provides loans, financing to these facilities to make them invest, whether it's in infrastructure or invest in processes or invest in human beings, their own competencies. The Medical Credit Fund provides financing for this. So since 2010, when the Medical Credit Fund started disbursing financing to these healthcare facilities, the Medical Credit Fund has done over $129 million in loans. And these loans have been disbursed to 1,800 healthcare facilities or enterprises. So we're talking about healthcare enterprises that range from a maternity home in a village to a pharmacy shop, where people go and buy medicines, to a primary healthcare center, to a medium-sized hospital. It also provides financing to distributors for medical equipment, and is doing very well. So, when we started this, we were working with the banks, local banks. That's also an important aspect to emphasize. We work with local banks because they had the networks to distribute the loans. The banks at that point, in the beginning, were not very enthusiastic about this because they see or saw the healthcare sector as risky. But, as we speak now, over all these years, the Medical Credit Fund has a repayment rate of 96%, which is very high, for an impact fund focusing on the bottom of the pyramid, so to say, facilities. The support from the Medical Credit Fund, the capital, it comes from financial, development institutions. It comes from investors. So, in the past, we've gotten monies from, a whole range of institutions. They give us the money, but they want their money back with return. And so far, we've been doing very well. I think there's also technology being leveraged here to make this better. And it's important to emphasize that, because what you see is that what a normal bank would do to anyone who needs a loan is to ask that individual for collateral. And your house, your office, your factory, your plant, anything to ensure that if you don't pay, they have something to fall onto. We saw that that's a detriment, to the smaller facilities. So with technology, and collaborating with M-Pesa and MTIBA, and installing tills at these facilities, we are able to get insights into the turnover of these facilities. Daily, you get digital insights, through their, because they're using the technology. And because we have that insights, we can deliver, we can give them loans, not requiring any collateral. And that has been doing very well. And of course, if you do all these things, then you will certainly be recognized. So this is a list of some awards that we have received, right from the Financial Times to IFC to CDC. We've gotten a lot of awards and recognition, from the World Economic Forum, about the work that we do. So thanks a lot for listening, and looking forward to the interactions.
Thank you so much. And let me be the first on this call anyway to congratulate you on the awards. Having award winning in your title is always reassuring, isn't it, for people to know that you're trusted, that you're good at what you do, that you're being recognized. So congratulations.
Yeah, thank you very much. Yeah, no, it's an important aspect of it. So one is that as an organization, you can really focus on what you do and do better. But our goal is that because the problem is so big, it's important that we share the lessons that we've learned, that we engage others. If they can implement the things that we do on their own, that's fine. And so, having this award, also helps open some doors for that kind of interaction.
Absolutely, yes. I think you're right there, because this is going to be an ongoing, all-consuming project. You've made a great start. It sounds very promising. I have a few thoughts. I was very curious. I was listening to you because it's not a system I've come across before. I mean, we know that mobile technology is expanding all of the time. And I suppose there were a few things that I thought of, putting my cynical head on. So, for example, I've got the credits in my wallet, on my phone. So I've got a few questions for you around that. So first of all, what happens if I lose my phone? What happens if the phone is stolen? How is that open to abuse?
Yeah, if you lose your phone, you don't lose anything. Your phone is just an interface to be able to access the services. So at the back end, the platform has everything. So all that you need is a telephone number, and then you can access all the information that you have.
So you wouldn't necessarily need to prove who you are. If you turned up at a medical centre, let's say, and they ask, well, how are you going to pay for this? How would they prove it's you if you're holding that phone and you've got that phone number? Presumably the database is quite strict.
Yeah. So the phone is the identifier, but of course, we collect information about the individual. Yeah.
Okay.
And yeah, so that helps in that case. And of course, you have the control, I think, at two levels. One is that the telcos, they collect information about the individual. So in the same way that the individual who loses his phone or her phone will have to identify her or herself to the telco, they have to do that if you lose your phone. At our level, you also have to identify who you are, and then we will check whether you are the person that you claim to be.
Got it.
Yeah. So the challenge is, so go ahead.
No, I'm absolutely fascinated. I'm asking questions that I think perhaps our audience would want to know the answer to, and you've got the answers to them. So I guess my next question is, so I've got this deposit of finance available to me in the wallet, and I know how much is there, and I roughly know what sort of costs are involved with different services that I might need. Would I be tempted to perhaps think, well, I'm not seriously ill, I ought to save that credit in case I get something else wrong with me? How do people make that judgment? Yeah,
so to begin with, the money that you have in your the mobile health wallet is primarily for health. And so you cannot take money there and say, I need to buy fish. So, I go and buy it. And we do that because, you cannot predict when you're going to be ill. And so it's important that we ring-fence, that's the technical word, ring-fence the the money that you have for health. So that's point two. Point two is that we're also looking at alternative sources for funding, and so it's not primarily about the savings that you make. It's also the entitlements that you have in an insurance program. It's also about your participation in a program that is funded by an entity that's interested in maybe addressing mother-child care issues. So when you bring all these things together, you have that amount, and you can also check. When you go to a facility, after leaving the facility, you get a message if they have to, and you have to authorize the payment. And that helps also, and you can at the end of the day check how much you need. When we did this in Kenya, it brought some safety to women, because people going to hospital with cash on them sometimes being attacked.
Yeah.
But if everything is in your wallet, your mobile gets stolen, you don't lose anything.
Got it.
Yeah. Then
I think it's an incredible thing. I mean, what would happen if you were, I don't know, badly injured, let's say, and you've got multiple health issues, and there wasn't enough money in your wallet? They wouldn't prioritize your broken arm over your broken leg, or how would they do that?
Yeah. So certainly that's a challenging point, and we're not trying to say that we can solve all the challenges in the healthcare space, because the mobile health wallet will function as much as there's a good insurance scheme. Yeah.
Great.
So
yeah.
You need to also have that to go with this. Yeah.
And that, I suppose, re-emphasizes your point about how you've joined up this funding, that it's more efficient now, that all of those bodies are, in one silo rather than separate silos, and talking to each other and ensuring that these things are being addressed.
Yeah. And as we speak now, we have a collaboration with the Global Fund. And the Global Fund is an entity set up to address HIV/AIDS, TB, and malaria challenges. And the partnership is about how we can use this technology to scale delivery of care. They are very much interested in the fact that locally, African countries will also have to mobilize their own funding. Global Fund will not be there forever. Yeah. So the point, the African countries have to mobilize their own funding. That's also part of the work that we do. Besides the technology within the organization, I'm also the director for advocacy. And what the whole thing is about is that if African countries don't mobilize funding, the external world cannot keep financing care. Yeah. So the partnership with the Global Fund is, can we use this technology as a means of supporting the countries to optimize the budgets that they have now for care? Yeah. And also,
I guess on that issue of funding, have you ever been approached by, a big corporate name, I won't name any of them, that would say, listen, we'll fund this, but we want to be able to send an advertising text to a person's phone, and sort of monetize their own advertising and their marketing so that they can somehow see some return? Would that be an abuse of that sort of privilege?
We are not in that space, and so we are not in that space, but we do work with private sector. Our whole initiative was started because at the beginning, people in Africa didn't have access to HIV/AIDS medicines. In Europe and the US, medicines were available. So we started by working with Dutch companies which has businesses in Africa, and they wanted to do something for their staff. Yeah, so collaboration with the private sector is there, but it's never at the expense of the people who are serving, and we don't necessarily ask for money. We are more interested in a company addressing their core practices, and because if they can see the value of something that will enhance their market, that's what they should do. Yeah. So our principles are above all things.
I think that's highly reassuring, and good that it's ethical, good that it's being done for all the right reasons. I think what you're achieving, and there's still much to achieve, is incredible. And the progress you're making, and you've shared those updates and case studies. So you must be optimistic for the future.
No, I am, particularly when it comes to the use of technology. I am because, if you want to provide care to poor people, you got to do it in an efficient manner because they are not in a position to pay more. So you have to reach huge numbers. And in reaching huge numbers, you need technology. If a technology company will have to scale, what they need is another server, and they can scale. If you want to build a restaurant in Africa, you have to build a building in every village. So the beauty of technology is that you can scale, you can reduce your transaction cost. And I think, whether we're working with governments or we're working with organizations, everybody is beginning to see the value of technology. And I think the change will come when we all embrace it and move the work forward. So the challenges are huge.
You wouldn't perhaps know until you see some of the presentations, but that brings to a conclusion the things that we've been speaking about today beautifully. We couldn't have rehearsed it any better. This idea that we can scale, that digital technology is available, that it can be used to benefit, and the way that you incorporated the financial and the insurance side of it is admirable. I want to thank you for joining us. It's been a fascinating insight. Good luck with all the work that you're doing, and enjoy the rest of your day.
Thank you very much for the moderation, and see you perhaps. Who knows?
We hope so. We hope so. We hope so. We'll see you again. We are, after all, going out worldwide over the next few months. That was Dr. Kwasi Boahene from Farm Access, who brings today's presentations to a beautiful conclusion. As I mentioned there, we've been talking about all sorts of issues, but that idea that digital technology can bring greater access to the health solutions that we're advocating today. So, brilliant day. If you've missed any of it and you want to catch up, then go to the Future Health YouTube channel. You can watch all of those presentations again, make notes, and you notice there that there's ways that you can get in touch with the individual presenters as well. They've shared some of their contact details. You can also go on social media, share what you're feeling and what you're thinking, maybe ask some questions using the hashtag Africa Health Week or Future Health, and you'll find us on the usual social media channels, Twitter, Facebook, LinkedIn, and we're here for the next couple of days. On the fourth day, you'll carry on networking. After all, that's one of the beauties of this platform, that we're here to network, to chat, to share best practice, to innovate, to learn, to challenge, and many, many other things. It's part of a wider series of health issues weeks that we've got running, and the next one is in the USA. I'll tell you more about that in the next couple of days, but for now we'll have a look at what's coming up tomorrow on Africa Health Week. In the morning we'll be talking about stem cells and a cure for sickle cell with Saman Dalvi. We'll also be with Jonathan Parr to talk about Africa Healthcare designing for the people and the role of the private sector, with Christine Hoggendorn will be there. So that's the morning sessions. Lots to look forward to there. I think we'll have a look at the afternoon once we've got through the morning session. There you are. I've whetted your appetite. You've got to join us tomorrow to find out what's happening in the afternoon. But of course, you can visit the website if you want to look at the programme, not just for tomorrow, but also for day 3 on Wednesday. For now, though, enjoy the rest of your day. It's been an absolute pleasure being your moderator and host. I'm sure you'll agree that there's a lot to be optimistic about for Africa through Africa Health Week. Thank you for joining us. Join us again bright and early tomorrow at 9:30. We'll be sharing more best practice ideas and innovations through Future Health series. See you then.